Hey, Vicky, do we want to give it a couple more minutes or?
You know what? Let's get going. You've got a quiet baby, so we'll get going. Let me just introduce you to everyone. I welcome everybody to the Complementary Therapies and Rehabilitation section of the CDS East Bay educational programs. This year, we've been trying to put these on for a couple of different topics, and this was one that we thought, with all of the new things coming up with sport horse management and so forth, dressage horse management in specifically, it's a great thing to know all the latest things. And tonight it's being hosted by Starwood Vet Group. And what's your official name? Starwood Veterinary Services.
Starwood, yes, Starwood Equine Veterinary Services.
Okay. And they are in, we have people outside of the area on the Zoom. So they are in the South Bay of San Francisco, as well as the East Bay. And Dr. Kelly Zatunian is the owner, and she is on tonight as the lead speaker, and Bridget McCarthy. Dr. McCarthy is on as well. And Kelly, you work out of the Woodside office, and Bridget works out of the East Bay.
Yeah, and we actually have a few other vets that we'll introduce you all to. We've joined quite a few of our vets together today for this presentation, so you'll get to meet a few more vets too.
Oh, great. Thank you so much. All right, I will turn it over to you, and you all can proceed.
Awesome. Thank you. I am going to very briefly introduce and then pass it on so that we don't have to hear her screaming the whole time. But thank you for the opportunity. And we're really excited to offer you all some insights and overview of a number of complementary therapies. Our team is comprised of 7 doctors now with 2 locations, one on the peninsula, one in the East Bay. And I'm going to turn it over to them to introduce themselves and then take over while she screams.
Okay, Kelly, because you now own the meeting, can you be sure you're letting people in as they, okay.
Yep, I'm getting those notifications. You got it.
Perfect, thanks. Okay.
I'm going to introduce myself first. I'm new to the practice. I work mainly over in the Peninsula area. I'm Courtney Martin, and I'm going to talk a little bit about chiropractic in a few minutes, but I am a certified chiropractor through the International Veterinary Chiropractic Association, and I'm also certified in rehabilitation as well. So,
great.
Sue, you want to go next?
Oh, sure. Yes. My name is Sue, and I am a RVT and registered in bodywork. So that is what I will be covering this evening.
Great.
I will help Bridget out because Bridget is actually our on-call vet in the East Bay today. So I'll jump ahead. I'm Dr. Jackie Dietrich. I am also new to the practice. I was previously working in the Peninsula, and about a couple months ago made the move out to the East Bay. I forgot to update some letters, but I do acupuncture, and then I'm currently in the process of getting certified in rehabilitation and starting my chiropractic courses as well. Bridget will be talking about mesotherapy and a couple other things such as like the PEMF waves and vibration study and laser therapy.
Great.
I'm Sophie Russell. I joined Starwood about a year ago, but I've been a general practitioner in the area for about 8 years. And I will be talking about shockwave therapy today.
And once again, thank you so much for inviting us to be here tonight and share this information with you. Like we said, we might shift a little bit who's talking based on emergency calls and crying babies. So thanks for hanging in there with us. As we said, we're going to cover some complementary therapies like chiropractic, acupuncture, bodywork, and massage. some of the common treatments that we recommend for our sport horse patients, like shockwave, laser, and mesotherapy. We'll do a brief overview of rehabilitation, because without that, none of these modalities work if we don't do the legwork and the foundational exercises. We have a couple of medicine updates, 2 interesting studies that you all might find interesting and have some dressage specific takeaways, and then we'll entertain your questions.
Great.
Okay, I'm going to lead us off with chiropractic. So chiropractic is generally considered a manual therapy. So in the realm of touch, massage, stretching, joint mobilization, which physical therapy and osteopath also fall under that. And then chiropractic kind of falls under the manipulation category. And so there's a definition on this slide kind of about, in a nutshell, what chiropractic is. And a lot of it has to do with not only kind of the mobility of the spine and the body, but also how that affects the nervous system and how that can affect how the body can respond and heal itself. So I won't read that. I'll let you read that. So everyone likes to talk about getting their back cracked or putting a bone back in place. And I think the thing to really remember about chiropractic is that we aren't changing anything that's not already in its normal range of motion. We're just trying to affect things and change things that are not moving appropriately. So we're trying to evaluate a motion unit, which we'll talk about in a minute, both in the axial skeleton, the spine, as well as in the limbs. And by doing so, we are affecting the neuromuscular system, how the body is taking in information from the environment, and how it's able to output towards the rest of the body. And when this is not functioning appropriately, obviously we can see this manifest as in pain, as in reduced mobility, poor performance, and also changes in muscle in terms of strength, and potentially also in certain specific areas that might be atrophied or not as well developed. So a motion unit is what we describe a lot of what we're trying to evaluate. And it's not just the joint itself. It's made up of all the things that surround it. So the joint capsule, the ligaments and tendons, the muscles, everything that binds it together. And any one of those things can be affected and affect the normal motion of that motion unit. And depending on where you are in the body, can kind of dictate what type of movement you have. So obviously when we're looking at the pole area, we have a lot of flexion and extension, but also a lot of axial rotation. When we're looking down the cervical spine, the neck, further away from the pole towards the thoracic spine, you're going to get more lateral bending. And as you leave the cervical spine, go about halfway through the thoracic spine, you're going to start getting to more flexion extension. As we head into the lumbar spine, you're going to continue to see that as well. It's where we get lots of our propulsion and movement to drive our movement forward. So depending on where you are in the body is going to really dictate what types of three-dimensional movement you're going to see primarily. And that's really important when we're evaluating, because we need to know the correct movement and what we should expect at each part of the axial skeleton or limbs in order to decide whether something isn't moving in the way that it should. So causes for reduced mobility. So it could have something to do with the joint itself, maybe specifically how the joints put together and how the articular surfaces are aligned. It might, like for instance, we can see congenital malformations, or this might also be an underlying cause of or an underlying result of osteoarthritis. We can look at the joint capsule itself, and we might have reduction in motion because we have inflammation of the capsule or fibrosis or scarring in a region, maybe due to an injury or again, due to some sort of conformational issue. We can also see issues at the intervertebral disc, which we can see disc disease, which again can result in osteoarthritic changes and reduction in movement. And then again, we can look at the ligaments and the muscles surrounding those joints and again, see restrictions due to fibrosis or lots of spasms that could again reduce how well some specific motion unit is moving.
Can I ask you a quick question on that? How do you go about seeing those things?
So I'm going to talk about that right now in terms of motion palpation. So I generally start my exams by palpating, doing a quick, like I watch the horse go a little bit. So I'll watch them walk in a straight line, and I'll sometimes watch them trot depending on the situation, and just kind of getting a sense of how they're moving, where they might have restrictions, where there might be some asymmetry. Then I'll also do a quick scan of their muscles and feel for trigger points or discomfort where that might be located. And then our main primary tool to decide whether something is not moving well is something called motion palpation. And there's a couple of diagrams on this slide to kind of talk about how we do this. So if you think about any joint there or any movement, there's something called an active range of motion, which if you can see me talking on your screen, an active range of motion, you're moving your finger around, and this is all active. So this has to do with your voluntary muscle contraction. Passive range of motion is when you add an addition to that, an external force. So this would be moving into a passive range of motion. So when we're assessing joints, we're working both on the active and passive ranges of motion, and deciding whether something is moving well through all those areas or not. And so something can be moving normally, something can be moving, not moving as well through all the normal ranges of motion. So it's just like decreased mobility, but it can get to all its normal ranges, just not to the degree that we would like. Something can be stuck and it won't move at all. It's literally just sitting in neutral, or it might be fixed outside of neutral. So if I'm evaluating a cervical spine, something could be potentially restricted and stuck more to the right than to the left. So we're evaluating by basically, I guess it's a little bit hard to explain, but when I'm putting put a motion, like I'm moving a joint through its passive and active ranges of motion, and if I feel like something isn't going through as well, we term it kind of a restriction or a fixation, and it can be any one of those different fixations seen at the bottom of the screen. Does that answer your question?
Yeah, is there ever a point where you would go in and say, okay, we need to ultrasound to really see what's happening within, like the picture before was pretty
yeah, absolutely.
Sometimes
sometimes I'm feeling things and I'm like, this is really restricted. We should, like, for instance, the cervical spine, this horse seems very uncomfortable. It doesn't just feel like it's just a little bit stuck or a little bit not moving as well. It feels like there could be some more underlying pathology. And in those cases, I would say we should x-ray that, because obviously if there's some type of significant underlying disease, you could certainly cause something to get a little bit worse if you don't know or aren't able to feel that is not within a normal, what I say in my exams on my paperwork, I think I say within normal limits for a routine evaluation. If something is like, this is painful, this is not normal for this horse, they're really restricted more than I would expect based on then that definitely would be a time where I would say we need to get more diagnostics. And it never hurts to have that. I certainly have had horses that have had a history of certain disease processes that it warrants having x-rays first, for sure.
okay.
Yeah,
Thank you.
of course. So in terms of when we actually make an adjustment, so this occurs kind of beyond the passive range in motion of something called a paraphysiological space, which is a little bit beyond the scope of this talk, but more specifically, this is just to describe that the adjustments are kind of on this spectrum of joint range of motion. So it's kind of on the highest degree of mobilization. And so in physical therapy, we actually do some mobilization, and that's kind of a low velocity, kind of stretching type method, whereas the adjustments are high velocity and they're low amplitude with a very short lever arms, which means that you're contacting specific spots on the spine very directly and going in a very specific line. So it's very important for my body position to be in a certain way and for me to know the angles of the joints in order to do a correct adjustment. And you don't have to be super strong or super big to do this. It's mostly about how quickly you can do it. And that creates that high velocity. So it is on a spectrum of kind of a physical therapy joint mobilization grade. And you can see in that diagram on the bottom, it's the highest grade for that. So where you can see on the other diagram to the left, where it talks about mobilization and stretching exercises kind of as a spectrum there, the manipulation or the high velocity thrust is at the very end of that. So it all kind of lies in a spectrum. And in some instances, touch massage, as we're going to talk about, stretching, physical therapy activities are more indicated for certain disease processes or certain things going on in a body, and manipulation less. But it all depends on your evaluation and what you feel. I think this is a question we get a lot. Should you hear an audible crack? And the answer is no. Sometimes you definitely will, but that's not, that doesn't what makes me decide whether I've adjusted something well. It's more based on going back through and feeling that joint again and going through its normal range of motion and saying, oh yes, it's moving much better than it was before. And that's how we determine successful adjustment, not whether you hear a crack or a pop. And then why is this important to why do we want proper joint function? Obviously, when you have altered joint motion, it can lead to lots of different compensations throughout the body. You can get pain as an inflammatory response, and you also have deficits in your nerve function. If you can see the spinal column there on the bottom and see where the nerves kind of exit, you can see that when something might be not moving as well, you could have some impingement on some of those nerves, for kind of lack of a better word, and not have as much, I would have inhibited input and output of like nerve conduction, which can affect how the body's moving as well as comfort, and also kind of interacting with the environment. So what can we see in terms of clinical signs? Maybe muscle imbalance or atrophy, so asymmetries to the muscling of a horse, or just lack of muscling. Poor range of motion, maybe you're riding your horse and you're like, wow, I'm really struggling, with bending to the left, doing this specific movement, or really getting my horse to sit back and engage their hind end. You might see weakness or even sometimes lameness or lack of soundness. And you also might feel your horse and be like, wow, they're super painful. They're having a lot of muscle fasciculations. And a lot of times the end result is they're not performing as well, or potentially not doing, able to progress, or really able to do the movements that you want them to do. So obviously our overall goals of treatment are pain relief, improving joint function, hopefully improving the range of motion, reducing muscle spasms and pain in that way, as well as improving the nervous system. And that whole idea with chiropractic, this is a short explanation of it, is to hopefully improve the overall function of the body as well and restore overall health.
Perfect. I love that acupuncture is after chiro, because the two also work synergistically together. A lot of the things that Dr. Martin was talking about, acupuncture can also assist with. So what is acupuncture? Basically, the definition is putting needles through the skin in predetermined sites, which is acupuncture points. Also, they can be considered trigger points as well. And the goal is to prevent and treat disease and address pain. Acupuncture can be looked at from like an Eastern and a Western medicine point of view. From an Eastern medicine point of view, you're manipulating the body's balance through regulation of the flow of chi. So you're removing stagnation and blockage and making basically sure that the flow of chi, which is energy from a Eastern medicine point of view, is balanced throughout the body. We use this frequently to treat conditions like arthritis, behavioral issues, muscle weakness, head shaking, allergies. And I'll even throw acupuncture points in for colic or horses with chronic diarrhea. There's a lot of internal medicine cases that you can use acupuncture for, and it's nice to have in your tool chest when you need to think outside of the box for treating some of those more internal medicine cases. There's lots of different ways that you can approach acupuncture. There's a large umbrella that includes dry needling, aqua acupuncture, which we use a lot of. It's actually injection of B12 in different acupuncture points, and we even inject them in some trigger points. So some trigger points can be over acupuncture points, trigger points being a bundle of tight muscle fibers. But trigger points can also be on their own too, and just be some muscle tightness. Electroacupuncture is also a different form. You can see that in the picture, the lower right-hand corner, and that's where we run electrical currents through different points. We can run them through different restrictions, similar to like what Dr. Martin was talking about. to relieve some muscle tension in that area. We can connect different points to stimulate different meridians, which we'll get into in just a second. And also we can stimulate different groups of muscles that have similar function to stimulate and relax them. The goal of electroacupuncture is to make your acupuncture treatment last a little bit longer and maybe treat a larger section of area without getting too crazy with the needles. Moxibustion, basically use moxie, which is basically heating herbs and stimulating different points. It's awesome when you want to bring energy and heat to an area that's cold. And that might sound a little goofy to say, but from an Eastern medicine point of view, you treat cold by warming it up and figuring out why it's cold. Often our horses with arthritis is a perfect example of this. So even just hovering over the areas of like carpal arthritis, for example, to heat up the area can be helpful. Hemoacupuncture is actually one of my favorites. We can use it. I love using it for internal medicine cases, but it's actually where you draw the blood of the animal, very simple, and then inject it right back into different acupuncture points. And the goal is to bring nutrition and stimulation to those points for a longer lasting and more beneficial and larger effect. And cold laser also can be used to stimulate different acupuncture points or even along the meridians in general. I love using this for horses that are a little needle shy though. I find it extremely helpful, especially when it's difficult when horses get anxious before you put the needle in. So traditional Chinese medicine is a large umbrella. Acupuncture falls within that, along with herbal, tuina, lots of different things. It's been in use for over 2,500 years, and there's actually been documentation of it in some way, shape, or form for about 8,000 years. We basically stimulate predetermined points, so that's your acupuncture points, along 12 different pathways, also known as meridians. So basically we're stimulating different fascial planes, and those fascial planes run parallel within the body. And there's a lot of research behind it. I just threw up a couple different searches to give you an idea. The word that some people use and that I like to use myself is acupuncture can sound a little woo-y to some people, especially if you're like me and have a little bit more of an analytical or logical pathway of thinking. But there is some study behind it. I always tell different clients, especially when I'm doing acupuncture on their horse for the first time, I'll explain the Western medicine point of view from things and the Eastern medicine point of view. Either way, it helps. And it's very cool because you can't necessarily tell a horse, hey, I'm going to put needles in you and we're going to do acupuncture on you and it's going to help. And I promise. They don't know what you're doing, and you can physically see the effects in real time. And that's probably one of my most favorite effects of acupuncture, is seeing like the real time response to it. So, but there is some scientific studies behind it. For those of you who consider acupuncture to be a little woo-y.
And can I ask you a quick question? How many treatments does it usually take to see a difference? Is it immediate in some horses, or it takes time? I've had it done to myself and had to go through a series. So
exactly. And you're kind of like peeling back layers. For some horses, you can see it after one needle. For some horses, it takes several treatments. It's very dependent. And one thing that I'm not including in this presentation, because we'd be here all night and all my other intelligent veterinarians wouldn't get a chance to speak because I'd go off the rails, is like there's lots of different things like effects of the tongue and the color of that and the pulses and everything. You kind of look at all those little tiny things and look at how they respond after one treatment and then determine how many treatments you need from then. So I would say typically for a performance horse, they would require treatment every 4 to 6 weeks. But at the beginning, maybe you want to do every week until we kind of see that they're not as responsive. The goal would be to stretch out the treatments as long as possible, because that means it's working well. Did that answer it?
Uh-huh. Thank you.
Okay, perfect. And this is just a little tiny, like a 4-second video of a scan. So what he's doing, the picture before were all your meridian pictures. And what he's doing is he's scanning with a blunt object, like I use like a needle cap, for example, or a pen or something. And you scan along the meridians and to different specific points that symbolize different things. Like I always scan my points for foot soreness, for example, and you kind of gauge the response. So like a scale 1 to 5 is kind of what I use, like 0 being no response at all when I stimulate a different point manually. And like 5 being he tries to bite or kick me, and like little twitch, like you can see at the beginning of the video, would be a subtle response. And you can kind of, I always say like when they go like this or something like that, that would be a considerable response for me. And you look at where each of those points are, and you kind of create a pattern, like, oh, this point might be for the neck or the foot, but all these other points are for the foot. So I'm going to put this in the foot category. And you kind of get a little picture of what's going on with the horse. It's great for like inconsistent lamenesses, or lamenesses that are too subtle to block, or I actually incorporate it into every single lameness exam that I do, because before I watch the horse move, I can already tell you a lot about maybe some subtle changes that are going on just based on the scan. The one thing that I have found inconsistent with my scanning is the ulcer points. Those things get me every time. We'll scan them, I scope, and then we see how consistent they are, but those ones can be the tricky ones. That's a frequent question of mine. Our goal with acupuncture treatment, though, is to control pain, resolve muscle fasciculations, similar to those caused by the restrictions and the tight muscles and everything like that that Dr. Martin was talking about previously, and also to kind of stimulate nerves. We know that our peripheral nerves can grow and regenerate. Our central nervous system struggles in that department, but our goal is to stimulate nerves, relieve pain, and ease muscle tension. And we can do that again by many different forms of acupuncture.
Amazing. We just have a couple questions in the chat. So from Karen, could you speak about acupuncture for managing mares that have extreme estrus cycles and other behavior applications where it can be helpful?
Yes, acupuncture, I don't do a whole lot of repro, but I do have a lot of different friends that actually use it to help in like reproduction in general, like in a breeding facility. As far as mares in cycle, I have had mixed success with that. Of course, there are the needles that help ease the flow of energy, as you will, for Eastern medicine point of view, as far as kind of like your meridians that align with your reproductive tract. But a lot of times I'll use it to ease that muscle pain. A lot of times you'll get a lot of tension in the lumbar area. And so I'll use it kind of like treating a lot of the side effects. I have found things like Regimate, Altrenagest gives me a little bit more bang for my buck as far as treating those horses that have very severe estrus cycles or behavioral changes because of it. I always like to rule out any other severe things like back pain or like a granulosa cell tumor, something like that that can be the cause of those things first. And I use acupuncture in that respect as kind of an additive therapy. Did that answer the question? All right.
I think
Sue,
so, yes.
You're the boss, Sue. So.
Oh, yes, I love that. And then we have one more question. Is it normal to not have needles want to come out during a session? If so, what does that mean?
For me, if a needle doesn't want to come out, I'll leave it in. Sometimes those muscles kind of hug that needle real tight, and it just means that there's a lot of stimulation and tension still going on. So I'll actually spin the needles a little bit, maybe run a little electrical current through it. And then oftentimes I'll massage the area around it. I'll look to what muscle it is and kind of look at the other muscles that work collaboratively with it and see what their muscle tone and tension is like, treat those muscles. And then typically I'll remove it once it's nice and loose. And some horses have the reverse problem and they kick those needles out right away, which I always like because it means that they don't need them anymore.
Well, what a wonderful segue in talking about muscles. And then we do have another question, but I think we're going to touch on that a little further on in the presentation. It's about PRP, platelet-rich plasma. So I think we'll hold that one till we get to that part of the talk. But we'll get back on board with talking about muscles. So I do body work, and it is a supportive therapy that does not replace veterinary care. There's various schools of thought and certifications and programs that are available, and all of them have their tips and tricks. Not everything will work for every horse. The same way some people like really tight hugs and some people want a pat on the back. Both provide support. You have to find the support that the horse wants. So there's sports massage, segmental mobilization, myofascial release.
We might have lost her.
Yep.
Oh no.
There you are. You're back.
Where did you lose me?
Myofascial release.
Oh, I was so good. Let's see if I can do it again. So soft tissue mobilization, range of motion exercises, and stretching. They all aid in restoring functional muscle length. So getting the horse to relax and kind of help everything return to its ideal length. And they can help horses and owners achieve their goals. So it can be beneficial to horses in all stages of their life. No one horse is, immune to getting stressed, having a tight muscle. They can sleep wrong, get cast, have a really hard work day. All of these things can kind of create tension and restrict movements. There may be times when other treatments should happen before body work to make it more beneficial. So if there is a medical issue going on before body work can be beneficial, it's ideal to get that resolved and then look into supporting that horse further in the recovery or return to work with body work. And there are a lot of theatrics that can be involved. Every horse will flinch or react if they're surprised or enough force is used. So it's important that body workers have a solid understanding of equine anatomy and body mechanics. That way you are not just tickling a horse and being like, look, when I stop tickling them, they relax. And you're like, yes. So body workers are working with the horse, not on the horse. So we are encouraging them to move into our hands through their range of motion. We are supporting them in finding their stretch and their release. So we can guide them through a range of motion, and that may be different based on the horse. So it can be their conformation, their history, a past injury. All of those things can play a role in how the horse will respond. Am I still gone?
No, you're here.
Oh, okay, good. And so as Dr. Jackie said, I like to evaluate the 4 T's, so tone, texture, temperature, and tenderness. So those are the things I evaluate as I am working through and with a horse. So you can see unusual muscle tone if a muscle is rock hard, or if, you know, if the muscles in the area are of the same muscle tone and there's one that isn't engaged. You can feel tight bands of muscle fiber, if there's scar tissue, if there's a hole in the fascia. You can feel a temperature difference. As Dr. Jackie was saying, it can be hot, it can be warm, it can be cool. So pay attention to those things. They can all provide information about how the horse is feeling and what they're going through. And then pay attention to if something is tender. Is it bothered by light touch? Is it resentful of palpation? If you're going through a range of motion, is it comfortable, or are they kind of doing it because they're good animals and know what you're asking? So if you slow down and listen to what they're telling you, you'll find out a lot more than you knew before. So the goal of a bodywork session is to locate and release tension and restriction throughout the body, kind of similar to all of the chiropractic work and acupuncture. It's all in the same thing. We are looking for areas of distress and aiding them through increasing blood flow, stimulating muscle fibers. It can reduce fatigue. I'm sure we've all had a hard day and then gotten a shoulder rub and you're like, I feel so much better. I am ready for tomorrow. So all of those things can provide comfort and help horses return to their peak performance. So you can even see benefits of increased range of motion and increasing stride length if it was restricted due to pain or tension. And it can reduce pain.
Great.
Thank you, Sue.
You're welcome.
So none of those complementary therapies that we just discussed are meant to be a replacement or an end-all be-all therapy for our equine patients, but they do, however, provide a major benefit by looking at patient issues from a different perspective. The same can be said about the treatments that we're going to go over next, so just keep that in mind. So our first treatment is going to be shockwave. So this treatment uses acoustic pressure waves or sound waves to induce micro trauma, which stimulates healing of wounds, ligaments, tendons, bony structures. The shockwave therapy has a direct cellular effect on the tissue, and it can stimulate osteogenesis, which is bone formation, and also revascularization, which will restore blood flow. Sound waves are changed into high pressure that can be adjusted based on the location and the specific injury being treated. So for example, if we have a very superficial injury that's close to the surface of the skin, we'll have a very minimal depth requirement compared to an injury deep in the back or neck or pelvis that would require a deep penetration of those sound waves. So we're able to adjust that as needed. Fun fact, shockwave was actually originated in human medicine to treat kidney stones by breaking up the stones into tiny pieces with the vibrations. And then doctors noticed that they were seeing an increased bone density in the pelvis around the kidneys. So they kind of took it from there. A few examples of injuries that can be beneficial from shockwave: bowed tendons, suspensory ligament injuries, bone spavin, which is a type of hock arthritis, splint bone fractures, navicular syndrome, vertebral spinal pain, which is also known as kissing spine, SI conditions, and back pain, just to name a few. So the objective of this treatment includes increased blood flow and growth of new vessels. It can stimulate bone formation in situations like bone cysts, increase production of natural healing factors in treated areas, and it can lead to higher quality and faster overall healing. The actual treatment itself is fairly quick. Most horses do need sedation because it's not the most comfortable. It also makes a very loud cracking noise if you have not heard it. We do recommend 3 treatments every 2 weeks and then repeat as needed. It does provide immediate analgesia for 2 to 3 days post-treatment, which is a nice perk. But overall, it's one of my favorites. And then I think Jackie's going to do laser to fill in for Bridget.
Can I ask a quick question?
Absolutely.
You mentioned that it helps in bone cysts. So is that OCD? You can use this on OCD and it'll create bone?
So it can. I mean, OCD, we typically will send to surgery, but absolutely, I've had bone cysts that have filled in with, or not completely filled in, but definitely improved with shockwave therapy. So it's definitely something to try. It's not 100% on every case, but it's worth a try if surgery is not an option. Absolutely.
Huh, interesting.
And unfortunately, Dr. Bridget had to go to ER. So you're stuck with me for a little bit longer. We're going to go over some laser therapy. There's lots of different types of lasers out there. A class 4 is the most, like, think draft horse compared to mini horse. It's the draft horse of the lasers. There's cold lasers, which is a common term, and those are great, and you can use those every day. Class 4 laser is for veterinary use, and it has extensive new data and research showing how much it helps with different types of injuries, especially like tendon ligament injuries, but also, like I mentioned before, we use it for stimulation of acupuncture points. We use it in conjunction with chiropractics as far as like releasing muscle tension. Sue, I know, uses it in conjunction with her massage therapy. The overall goal is to reduce pain and inflammation. And it significantly speeds up the time that injuries and wounds take to heal. And it works on a cellular level. So long story short, it creates more energy, leading to more healing.
So is that similar to the shockwave then?
It's similar in principle in that both aim to generate new healing and stimulation. They just work in different ways. So shockwave will work, like Sophie had said, micro vibrations to stimulate neovascularization. So new blood flow. Laser works the same way in that respect. Laser also works by stimulating different immune factors and different regenerative ways that the body like basically heals. I'm fumbling around with the wording, but for example, I'm better with examples. For example, like a tendon, you might not choose to shockwave it because those micro vibrations might add to the tendon fibers unraveling. You might choose laser therapy because it will stimulate a lot of different cellular regrowth. And in some studies, we're showing that it has actually more regrowth with a certain type of elastin and collagen that allows more kind of stretch, allows more flexibility within the tendon compared to fibrous tissues, which you see without laser therapy. Did that, I kind of fumbled around with that one. Did that?
No, that's all right. No, I get it. It's just there's obviously overlap, in a lot of these things, and they're obviously complementary to one another. It's just, I was curious why you would use shockwave over laser or laser over shockwave, if you're getting the same thing done. But obviously the shockwave's a little bit more, to me, intrusive to the body.
It's interesting. And that's like, we are all, for every topic that we're talking about tonight, it kind of just scratches the surface. There's like, it's like the tip of an iceberg. The most fun thing in veterinary medicine, for me at least, is to take a very unique injury, because every injury is different. Even a bowed tendon is different than another horse's bowed tendon, because everybody has different jobs. Everybody has a different immune system. Injuries are in different locations. Every injury is very unique, and it's fun to chat about different pros and cons of using a lot of these modalities. So a lot, you will see one vet might choose this, another vet might choose this. It's not right or wrong or anything like that. And it's a really fun time to be in this kind of medicine, because a lot of new research and funding and different tools are coming out for a lot of the same things. So I always say it's very horse dependent, very injury dependent.
Mhm.
And I think I've gone off on a tangent.
No, it's all right. What about this, your class 4 that you guys obviously use, and then
Yeah.
the cold lasers, is a cold laser considered the far infrared light, or is that even something different, or is a cold laser just getting in like a half an inch, or I don't know what the difference
Yeah.
really
Yeah.
is.
Oh, go ahead.
I was just gonna say the bottom line is the delivery of joules. So the treatment for laser therapy is, we say we give mils of this type of medication or that. With laser therapy, we give a certain number of joules, and that's determined by the location of the injury and the depth of the injury. So there's a sort of a formula that the system does for us that determines how many joules we need to deliver to treat a particular injury. And the strength of the laser. So those classes are indicative of how strong they are, and actually the potential risk of misuse or of injury.
Mm.
And so because it's a class 4, it is higher risk for injury to the cells if it's not used properly. But what that gives us being stronger is that we can deliver those joules in a faster amount of time. So some of those cold lasers, they will deliver joules of therapy, but if we're sitting and treating a tendon for 8 minutes, those cold lasers should truly reach the same level of joule treatment. You're sitting there for 30 minutes plus.
Mhm.
So that's part of it, is just the strength of delivery of those joules of treatment.
Okay. All right, sorry to interrupt.
No, you're fine. Mesotherapy. So this is a really fun one. This is one of my favorite things to do. Kelly's going to show a video, and I believe this is either Kelly or Bridget doing mesotherapy. And what they're doing right there is little tiny intradermal injections. And we have a little concoction, either carbocaine, lidocaine, saline. Sometimes I like the color and it's a little bit fun. I love using B12 mixed in there too. But basically what mesotherapy is frequently used for is breaking the pain cycle. I think Bridget has a very thorough, yeah, there you go. It's used commonly over the neck, the back, sometimes the pelvis. Basically, the goal is to stop pain. So you're basically inhibiting sensory nerves. So if you look at the horse, there's a map of different nerve segments over the horse, and you usually treat where the problem is, that segment, then you treat the segment before and the segment after. The overall goal is to stop the pain though. And you pretty much see results within the week, like 3 to 7 days, full effect within 10 days. Some patients, you'll have to repeat it 2 to 3 weeks later if necessary. We also use it as a diagnostic, response to treatment tool too. So a lot of the times we don't have a big referral facility where you can bone scan everything or have a very overhead x-ray machine or something like that. So we use mesotherapy and the response to it to check back pain, for example. There's a couple other things we thought that we would throw in there. They are things that you'll hear frequently. A PEMF, basically, and a CC loop is one of the ones that has a lot of research behind it. The Beamer blanket is very popular, especially in the horse world. There's a lot of data available. Some you have to be careful. Some aren't great studies and some are excellent studies, but basically they reduce inflammation, as is almost everything that we'll talk about tonight, because inflammation is key. It has been FDA approved for non-union fractures in humans, which is interesting. And it does provide short-term pain relief for mild back pain in horses. Vibration study There's a lot of things that go under a vibration study. It can be anywhere from like a little handheld vibrator, like the ones that you find at Bed Bath & Beyond, where you can stimulate vibration over different muscle bodies, or I use it over the frogs or heel bulbs of a horse. And then what we talk about a little bit in more depth in this slide is like your TheraPlates, or vibration plates, and they can be very helpful. One of the more popular studies is also hoof wall growth. It has been shown to do that. And a study in UC Davis, overuse of it can hypertrophy back muscles. So it has been studies have shown that it does increase the cross-sectional area of a muscle as well. And then there's magnets, ceramic blankets, boots. Horses like them. The theory is to reduce inflammation, reduce pain. There's not a whole lot of studies behind it, like the other modalities that we're talking about today. But if they like them, whatever works is great. So is this Bridget's slide, or is this yours, Kelly?
I think this is a segue over to me, and thanks, Jackie. I think what you've heard from us in, a number of the different slides and in our answers to some of your questions is basically all of these modalities are great. They have the overarching theme of relieving pain and reducing inflammation. The question about what will work best for each individual patient comes down to having a diagnosis so that we know exactly what it is that we're treating and can truly follow up and make sure that whatever therapy we choose, we're seeing the appropriate response that we're looking for. If we're not seeing the appropriate response, that gives us an opportunity to pivot and try something different. So, also keeping in mind that there are some of these treatments that we've talked about that are contraindicated with patients that have particular health concerns. So as a brief example, we don't use laser therapy on patients with cancer, some with neuro conditions, and also those with pregnancy, because it does alter cell growth. And there are some types of cells that we don't want to stimulate over activity with. I think kind of close out this section, rehabilitation in my mind is the process of taking that diagnosis that we have through our veterinary assessments and going to the next step, which is what every client and owner asks us. Well, what are the next steps, and what does this horse's future look like? How many months is it going to be till I get back to the show ring? Are they going to be able to perform at their prior work level, etc.? And so I think what I love about the certification process that we went through is that it kind of just ties in all of these modalities and all of the veterinary work, and then just the listening to the horse, which is what we all, I think, need to stop and do a little bit more of. And yeah, as I said, it can be overwhelming. Vicki, I think you with your question hit the nail on the head, and that's how do we know what to use? We hear about all of these different things. What comes first? What do we follow up with? And to me, the bottom line is getting that diagnosis, but then we also need to do our homework and make sure that our patients are systemically prepared to respond properly to whatever therapies that we are going to perform. Some of these therapies can be quite expensive and time intensive. And so if we are going into it with a patient that is not fully ready for those therapies, or isn't also getting the additional legwork and foundational work, we're not going to be successful. The same could be said for somebody, who's suffered an ACL injury themselves. If they're not doing the rehabilitation and their muscles aren't strengthened to actually support the joint around it, then their surgery and their healing time is not going to go as well as somebody who does the homework and does all of the supporting exercises. So that's what this is all about. It's restoring mobility to joints that maybe have reduced function because of an injury or inflammation. Certainly reducing pain is our primary goal, and then trying to get the joint environment or tendon environment back to normal condition. The sooner we get it back to a normal condition, the faster it will heal because we've reduced that inflammation. And rehabilitation, much like doing this acupuncture scan, a little bit like doing the chiropractic scan, it's all about looking at how a horse is functioning, how they respond to the normal functional movement that we ask of them. And so one of the steps that we'll take is to take them through ranges of motion, as you can see Dr. Moding here. Can they bend their carpus all the way up where the heel bulb touches the elbow? When they're being trotted out by one of our technicians, are they sound? Is their muscle moving in normal form? Is there any asymmetry between how the pelvis works? And also, how are they performing under saddle? Are there any particular cues or issues that the owner and trainer are picking up on that can help us to sort of tailor the exercises and strengthening that we focus on? We offer stretching, which is also important, and part of the routine, just like it is for us when we exercise, to make sure that we are asking those tendons and ligaments to kind of strengthen and lengthen, much like we would do in Pilates. I liken a lot of these things to the Pilates exercises. Are we properly in proper form, and are we really trying to get those muscles long and lean? So an example of one of the stretches or exercises for strengthening that we like to do is the pelvic tuck. And I add this as an example. And I'll actually just talk you through it instead of you trying to hear me on the video. The pelvic tuck is very similar to Pilates, where they make sure that you actually have your pelvis in the proper position, so that you are bending and using your muscles properly through those squats that they ask of. And so all of these videos are available on our YouTube page, and they're really great exercises, especially in the rainy days when you might not be able to ride. Great exercises to start working with your horse. So this second one does a better job. He's a bit more exaggerated and responsive to me asking him for that tuck. And I'm basically just stimulating right at the tail head, kind of rubbing in. I like to use a hoof pick if they're not super responsive. And it's just asking them to give us some stretch and bend, flexion, and extension through that pelvis. You can see a pretty dramatic response there. In the video, I say, always check the horse and know your horse before you stand directly behind them and ask them to do this. I don't want anybody getting kicked in the process, but it's a really great exercise and a thing that you can do to kind of promote some strengthening. And there's several other examples. If you're interested in those, again, you can access all of these through our YouTube page.
Great.
I like to share this this video example because the picture on the left shows just these uneven cavalettes, and I liken this to the football players that you see doing the drills through the tires, where they have to, quickly lift their legs and jump through. We did this exercise when I was going through the certification for rehabilitation at a show barn on the East Coast, and they brought out their fancy, beautiful Grand Prix horse. So this is, a horse that one would think is quite fit, is in a high level of work. And we asked him to go over these uneven poles where he really had to be thinking about his footwork and thinking through some of that fast twitch motor skills. And this is how he did. Let me put it in slow motion so he makes it through the first one, makes it through the second one, and then it's just a lot to ask. So that's all to say, even the most fit of horses, the one that they brought out and thought he's going to be able to do every one of these exercises that you put in front of him. We don't ask them to use that really high, fast twitch, high motor skills frequently. And I think some of the cross training that we ask of them is really key for preventing injury and really strengthening some of their responsiveness to lateral work and things that we ask of them. So may look really simple, but it's actually can be quite complex. There is that link to the YouTube videos, and Vicki, we could certainly share that with you to pass along to everyone.
Yeah.
I wanted then to jump over to just two studies that I thought would be of interest to you all, that I'll briefly go over for the sake of time. This one was a study by Sue Dyson looking at facial expressions, and what she found was that there was a relationship between all of these different signs: tongue out, head tipping, being above the bit or sort of fighting the bit, eyes closed, mouth open, ears back, eyes to the side or kind of wide-eyed. She found in her study that there was a correlation between these facial expressions and lameness or pain responses. And they were able to confirm that by actually looking at these horses, doing nerve blocks to remove the pain stimulus, and these facial expressions went away or were reduced in the frequency of expression. So that's all to say, pay attention to your horse. You all know, how they come out, how their head carriage is, what their general demeanor is. And I think that shouldn't be discounted. And, I always love to hear when clients say they're just not themselves. That's a challenge, right? I always, know your horse. And so if there's something that's different about them, it's worthy of a conversation that there might be something a little bit deeper underlying or a pain response going on. Mm-hmm. So interesting study, and all to say, pay attention to your horse. And if something seems off, investigate. And then there's a second study that was all about sacroiliac pain. And I thought that was nice to touch on after showing you those pelvic tucks in a horse that can really, really do it and do it well. This study looked at 74 horses, and they presented for lack of impulsion, reduced quality of movement, being solely to the leg or not wanting to move forward, throwing the rider forward. So if you've ever been riding and just feel like you can't get your position back and in your seat, reluctant to take the bit, difficulties with doing lateral work, and then swapping off their leads or unable to do flying lead changes. Those were the common presenting complaints. So some of you might be thinking, I've been there with my horse for some of these issues. 60% of the horses that presented were dressage horses or show jumpers. And so this is a more commonly noted issue, which is sacroiliac pain in those demographics, because I think of how much we ask them to rock back and really utilize their hind end and musculature. So I will just put in my quick little public service announcement. A majority of those horses were also overweight. So we're not talking about nutrition tonight, but I think that that's a high consideration, is making sure that our horses' body condition scores are not too high. I know from just being pregnant and carrying around an extra 35 pounds, it's hard on the joints and it's hard on the back. And so any little bit of extra weight we can take off of our horses, that can help them to carry themselves better and perform better for us and preserve their joints. So that's my quick little PSA about making sure our body conditions are appropriate. Mm-hmm. And with that, kind of just as Jackie said, tip of the iceberg, but we would be happy to answer any questions you have. And I know that there was one that was sent to us in advance. So Jackie, did you want to address that question?
Sure. Props to whoever came up with this question. I had to do some digging. Summit versus Equine. Summit has been around as a replacement for Adequan. It's a 5 ml IM injection used very similarly to Adequan, but it is significantly more cost effective. And so I think a lot of people are curious of if it's worth doing Summit versus Adequan. I have my personal feelings on it, which I'm happy to share, as is probably all the other doctors. And who knows, maybe we all might have different answers for you, but let's go through the facts first. Adequan, it's been around for about 30 years. It's the only FDA PSGAG available. And basically through multiple scientific studies, peer-reviewed papers that are available, it reduces inflammation, restores synovial joint lubrication, repairs joint cartilage, and it says reverse the disease process. Now we have to be very careful with that last one. Osteoarthritis is the degeneration of cartilage first, then resulting in bony changes, because once you don't have cartilage, you have that bone on bone interaction, which causes the bony changes that we can see on radiographs. But on radiographs, we can also see joint collapse based on the space that we see in between the bones. It can't necessarily reverse bony changes. However, a brief way that we use Adequan is it basically helps cartilage health. So deterioration, the scaffolding of the cartilage, it does help support all of that. And in that respect, technically, it can be, they use it on the website as reverse disease process. Using Adequan will not reverse bony changes progressive osteoarthritis in certain joints. It's also very joint dependent. I put a link there because it does a far more thorough job than we have time for today of how it works. But it's a 5 ml dose. You give it every 4 days, a total of 27 days. So 7 doses every 4 days. And that's because it stays and has been found in the joint from 2 hours after administration up until 96 hours following administration. Summit is used very similarly. It's an IM injection. You do the shot every 4 days for 16 days, so 4 injections. So it's basically a chondroitin supplement that is injectable. We all know that even for people, we can do oral chondroitin supplements. This is the wording from the website, the original one. It is important to note that that it's not FDA approved. I spent a good amount of time today looking for studies linked to the website, and I'm sure that there are studies to have it become this popular. But with the time limit today, I honestly could not find too many linked to the specific drug. It's also important to note, especially I'll use the PEMF modality, basically a CC loop versus Beamer versus something else that you buy off of Amazon. A lot of those companies, such as a CC loop, have specific studies using that product and noting the outcome and whatnot. I couldn't find any from Summit. I did find some papers studying like the IV IM versus oral chondroitin supplement and the bioavailability. They work in different ways. However, they claim the same thing, that it's for joint health. If I were to put my money somewhere, and this is where, if you're asking my personal advice, me as an individual, other veterinarians or other Starwood veterinarians might have a different answer. So if somebody has a different answer, feel free to chime in. But for me, I feel much safer as a veterinarian putting your money into an FDA approved product that has been tried and true. And I've seen and had good results. And in my personal opinion, it's worth investing in Adequan or Legend. I tell people simply, Adequan helps the cartilage. Legend helps the lubrication of the joint. It's a lot more complicated than that, but that is a very short answer because I know we're running a little short on time.
So there aren't any real studies that say chondroitin over poly G. is better or worse, or there's nothing that says they don't ever compare those two?
Not to my knowledge, and that's not the end all answer, to be honest. I had about 30 minutes to look it up today. But in that 30 minutes, looking at deep dive and Google Scholar and stuff like that, which are a collection, like deep dive is a collection of peer reviewed papers. I personally did not find anything. Let me just make sure. Dr. Martin is reminding me to make sure to talk about regenerative therapies as a group as well. But sorry, I thought it might be on that. But yes, I did not find any supporting using Summit over Adequan.
And I think the bottom line from a kind of a legality and that side of things is that we as veterinarians, because there is an FDA approved product available that meets the needs and provides this function of restorative joint support, we legally have to recommend Adequan. And then on your side of things, should something happen with administration of one of these medications, if your horse was insured, they would be covered with an FDA approved product. There would be consideration for lack of coverage should you use an off-label product. So not to scare anybody, but just, there are reasons why we recommend those things, partially the legality, partially the insurance potential. And we know because of those studies that if you're going to spend the money, we want to know that it makes it to the joint. And we can tell you that with Adequan. We can't tell you that with Summit.
Mm-hmm. Yeah, that makes perfect sense. And that's why the question was asked.
Yes, good.
Hopefully, Lisa, I think you're still on. Did you want to ask anything further on that? Because that was her question. Her picture is still up, so I'm not sure. Okay, that makes a lot of sense. And I think we always have to think about the insurance side of things, unfortunately. That I didn't even think about it until you just said it. If it's not FDA approved, they could just dismiss the whole thing and say, well, you used the wrong product. So good. That's a very, very good point. I have a question too on PRP, which is also, and stem cell, which is also very popular these days. What exactly does PRP do, and what is its efficacy?
I feel like that might be, we might need to have another night. So platelet-rich plasma falls under the biologics category. That's sort of like the big umbrella. And you'll hear things like PRP, prostride, stem cell, alpha-2 EQ. There are a million different products out there. It seems like a new one every year. And the bottom line with those is that they are using proteins and other compounds from the body. They're processed in a certain way to collect concentrated amounts of those different proteins or cells, and then utilized for treatment of different injuries. I would love for us to come back and really dive into those, because I think that actually warrants another presentation, because there are so many different modalities. But to answer your question about efficacy, they are quite efficacious when utilized in the appropriate types of injuries. Okay. So major tendon lesions, major joint injuries would be kind of my quick two reasons we would use them. But yeah, happy to come back and do a whole, because there's so many different biologics that we could break down for you. Great.
That would be super. Okay, well, are there any other questions popping up, Sue, that you're seeing? Oh, right here.
There was a question on class 4 lasers. and just like what separates it. Basically, class 4 lasers are above 500 milliwatt powered lasers. Yep.
Am I audible? I
Yes,
was
you are
going to
now.
ask the question. Okay, so I'm just really curious because I have been using the laser therapy and I bought something a little bit beyond the $100 to $300 range. And so everything I read said that if you got some of the bulbs that were at 800 and, 805 or whatever nanometer wavelength, those go deeper because they're longer wavelengths and they can penetrate deeper into tissue versus the more common 600, whatever it is, wavelengths. And the 600 ones are visible, so they look like red light. And then the 800 nanometer we can't see it with our eyes, so you really don't even know if those bulbs are working. But I did go ahead and spring for the one that had 5 of the 800s because I was trying to penetrate deeper to a navicular cyst. And I was just curious, the veterinarian grade, they do have a bulb, they do have a wavelength, and I'm just wondering what wavelengths do those lasers use? I have a friend that does a lot of laser work and she claims that those more expensive ones are like $20,000 and maybe the normal barn owner like myself wouldn't want to use one. But do you have an opinion of just the more $700 variety that have a couple of the different wavelengths? I find it's also really useful for my own little joints and aches and pains. So in fact, I find a lot of these things, even the sort of the percussion instruments too, they end up being taken up by husbands and things because they're so relaxing and useful, and they leave the barn altogether. But anyway, so I was just curious about those lasers. I find that whole concept really interesting. And I was wondering what's in the veterinary laser that's so different than the run of the mills that maybe most of us would find more affordable.
The class 4 lasers are, I don't believe you have to have a medical license and degree to purchase. The next highest class of laser that you could purchase would be the class 3B, and that's about 5 to 500 milliwatt lasers. Those you're going to be your more expensive lasers, and they're kind of like, to use the analogy of like the mini to the draft horse as far as power goes, they're going to be your thoroughbred, exactly. Like, for example, they're not, they definitely have their purpose. I love it when clients or trainers tell me that they have one because we can use it multiple times, and you might do certain treatments like 3 times a week if you're treating a specific injury with your class 4 laser under your veterinary advise like basically what they advise depending on the injury. But treatments can be done in between with the lower class lasers because they aren't as powerful. What we worry about from a practical standpoint and why a lot of these laws are in place is specifically OSHA's involvement as far as your eye safety. You really can damage your retina, especially with even the class 3B laser. It also has to do with skin damage because you can actually damage horses' skin. So for example, our class 4B or 4 laser that we use with darker skinned horses, we do have to be mindful of any kind of skin reactivity. So it should be done under the advice of a veterinarian and monitoring of a veterinarian. But the lower level lasers are great for stimulating, the nerves underneath the skin. They don't penetrate as deep as the class 4B. I think they're great for stimulating different acupuncture points or even relaxing different muscles, especially the lumbar region. I do not think that they don't have a purpose.
Yeah.
I definitely think that they have a purpose, and I enjoy utilizing them at the barn. Class 4 laser is kind of your big guns to treat chronic back pain, for example, or a tendon ligament injury, specific injuries, and they all have different protocols and dosage and timing and everything like that, like Dr. Kelly was explaining.
Cool, thank you.
Okay. Well, thank you ladies so much for spending your evening with us. And I'm sorry for Bridget that she had to run off before it even started. That's the life that you all lead. And I'm sure you're all just going, oh, but it wasn't me. But thank you again. You guys have been great this year, and we'll definitely invite you back to do some follow-ups as we were talking about, because I think these are things that all of us need to know more about. And it's great to be able to just really talk it through and have be able to ask our questions and so forth. So thank you so much. And we will see you soon. Have happy holidays, everybody.
Great questions. Thanks, everyone.
Thank you. Bye.
Bye.